Good evening and welcome to the September 16th meeting of the Oakland Community Health Network Board. At this time, if you can, please rise for the Pledge of Allegiance. Allegiance to the flag of the United States of America. Sheila, could we have a roll call, please?
Mr. Young.
Here.
Mr. Furman.
Present.
Dr. Giles. Pastor Jones.
Present.
Dr. Guadalupe. Here. Ms. Woodruff.
Here.
Dr. Hans.
Here.
Ms. Newman. Ms. Root. Ms. May. Mr. Smith.
Here.
Mr. Cowan.
Present.
You have quorum.
Thank you. Now is the opportunity for public comment. We ask that when you address the board to please state your name and your address or where you're from, and in Oakland County or otherwise, and also please limit your comments to 3 minutes. Is there anyone online who wishes to address the board?
If you are online and wish to speak for public comment, please raise your hand at this time.
Okay, thank you. There's no one online. Is there anyone in the audience who wishes to address the board this evening? Yes. Please come to the, can we get the mic activated?
Good evening.
Good evening.
My name is Bridget Biondo Smith. I live out in Milford. We have two individuals that are young people that are supposed to be served by Oakland Community Health Network. We're having a lot of issues with getting things paid for direct service providers for several months. I have a son who's out at Calvin University in the Life and Career Studies program, who I believe Calvin's having a hard time getting coordination to do credentialed services, and that's putting him at a risk of at a risk at this point. And he's been there for several weeks, and we're very concerned because we're not close by to help him out. And our anticipation was that this funding would have been coordinated and put together already by the time he got there, and we're just having a real hard time. And then with my daughter, she's in the Huron Valley schools. Our lovely Samantha here has been really supportive in helping us find direct hire, but now we can't seem to get our direct hire support person paid. So we're not going to have that person, able to do that in the future. And that's primarily my concerns at this point. So I'm just wondering, I haven't been able to get many answers, not a lot of transparency of how to get these problems resolved, and I'm not sure where to go from here.
You want to?
Sure. Is Linda here? Our customer service manager is normally here with us, but we will have somebody get your information and follow up with you directly, specifically to address the concerns that you have.
I appreciate that. Yeah, I've contacted customer service and GT Independence and all the people that are pointing fingers at everybody else, and I know that there's some concerns with the state of Michigan trying to coordinate with you guys with the whole funding with the Calvin situation. And again, we are now delaying a long time. Like I said, I'm concerned for my son's well-being, and I don't understand what the issue is with the state at this point, but I figured I'd talk to you guys first so we can maybe problem solve that before something happens that, otherwise wouldn't have happened had he had supports in place.
And we appreciate that. We've been working almost daily with GT, and so we will definitely get you in contact with the persons who can answer your questions and get this resolved as quickly as possible.
That's for my daughter. It's the state working with you guys and with Calvin University as my son. So that's definitely the immediate need. And the one with GT, I'm hoping that they'll back pay the person who was our direct hire, because they haven't paid him. So that's going to be really difficult in the future to get further services from anybody if we tell them there's going to be a problem getting paid.
Absolutely. Suzanne, can you get her information for us, please? Yeah. And make sure we follow
We'll have you talk to somebody before you leave, and they will get back with you. So somebody can look at the file or the information,
I would love
and
that,
you can say exactly what the issues are and see if we can get to the bottom of this. And you came out tonight, and we owe you at least that much of an answer.
I appreciate that.
Okay.
Thank you. Yeah.
All right. Thank you.
Anything you'd like to say from the support coordinators?
Well, I don't know that.
Can you?
I don't know.
May Samantha have 3 minutes
Well,
for her own?
Well, if you want to speak, you're entitled to. But if we want to,
I can be
okay.
done with my 3 minutes and can.
No, that's fine. That's fine. No, I have no. We're a public entity, and we're here to hear from people. And so, if you want to just move the microphone over.
Will.
No, you just move the microphone. And if you just want to state your name and.
Sure. My name is Samantha Fritz.
Okay.
I'm an independent support coordinator. And I didn't prepare anything. I was really just piggybacking off of her. Apparently the issue is...
You could speak a little closer to the microphone.
I'm
yeah,
sorry.
Thank you.
A lot of the issue with Calvin University specifically, it sounds like from Calvin, that there have been some changes with the credentialing process through the state of Michigan. And so they were... sounds like, from what I understand, they were almost through the credentialing process with OCHN when everything changed, and now they're having to kind of backpedal before they can be credentialed to do a site visit and all this different paperwork than was initially thought. And so when, when we initially thought that he was going to have his support in place and Calvin was going to be credentialed on time because they started this process months ago, so his parents sent him up there thinking everything was in place, our authorizations are in place. However, Calvin is not able to bill for the services because they're not a credentialed provider yet. So it's really been a difficult process, and we're kind of trying to manage it on our end from a distance with him being in Grand Rapids and us being here, just trying to help him navigate these things without the supports that he requires while he's there. And so it is a very important issue that because he is so far away, and these supports were put in place, but they're not able to provide them because of the credentialing process being held up.
Okay. All right. So that's good, and I think Suzanne was hearing that. So we'll find out if someone here can help cut through the clutter so we can get things ship-shape. Okay?
Sure. That'd be
All
great.
right. Thank you very much for coming out. Is there anyone else in the audience who wishes to address the board? There being no one, we'll move on to our next item, which is Stories That Inspire Hope. And Suzanne, you have our guest this evening to introduce.
Good evening, everyone. It is my pleasure to introduce Chris Odrosky, and he is a peer recovery coach with Hygera. He is also an addiction advocate. I told him he needed to tell us a little bit more about that. Being that it's Recovery Month in September, that it would be fitting to have one of our outstanding, dedicated peer recovery coaches to share his story and successes. So with that, I'll turn it over to Chris.
Thank you very much, and thanks for the invite. Appreciate being here. I am a peer recovery coach and I work for Hygera Health. I work currently for Hygera Health. I work at Henry Ford Wyandotte Hospital as their peer recovery coach for the emergency department as well as the floors. So when someone comes in and they get admitted for various reasons, if one of those reasons has anything to do with substance use, I will be asked to go see them. Oftentimes I meet with individuals in the ER and they're not ready to talk yet. So I have to kind of literally follow them upstairs and wait for them to be ready to talk. I've been a peer recovery coach for going on 15 years. And I've been working 14 years, been working in the field of addiction recovery for about 15 years. I've had different roles at Hygera. I've worked in just about every place that a peer recovery coach can work, except for MDOC. I've worked in inpatient, outpatient, outreach, hospital, every version of a hospital where I was an outreach worker going into hospitals, and currently I'm stationed at a hospital. I am a recovery advocate, meaning I've had the opportunity to do some public speaking. I've presented at the Substance Use Disorder Conference, the Peer Conference, Social Workers Conference, few other conferences that are escaping me at the moment, but I have a couple different degrees in communication, which helps me with my presentation skills and my love for public speaking, and I know that's not common. Most people are afraid to talk in front of groups. I am not one of those people. I'm also a very proud, sober musician, and as luck would have it, I'm wearing my sober rock and roller shirt. I did say this actually is my Tuesday shirt, so it just happens to be. They let me wear shirts at the hospital, so I was wearing dress-up or button-up shirts, and I was like, I'm in an emergency department. This could get gross at some point, and so I asked, and they said, yeah, you can wear like recovery-oriented shirts. A lot of the emergency staff, they support local EMS and fire by wearing the shirts that they provide, and they usually have like local Lions themes or tiger themes and stuff like that. So I wear my recovery-oriented shirts, and that job keeps me busy. Recovery advocacy keeps me busy, especially this time of year with the conferences going on and all the different opportunities that are out there. One of the things that I talk about is about multiple pathways to recovery, specifically meetings. So recovery support meetings. Most people, when they hear that, they think of 12-step groups, AA, NA, which I found very helpful in my own personal recovery. And I've learned about those meetings through my own personal recovery. So with everything that I've been able to accomplish as a peer coach and all the opportunities that I've had as an advocate, it all starts with the recovery part. So I'm very happy to say that I haven't had a drink or a drug since October 6th of 2008. I have a birthday, thank you. I have a sobriety birthday coming up, so there'll be some cake in my future. And my mom always takes me out for a steak dinner, so every October 6th I'm eating very well. And without that, I don't get the opportunities to be a coach. I don't get the opportunities to be a speaker. I don't wear the sober rock and roller shirts. I don't know what kind of shirt I would make for myself before I got sober. Drunken Idiot would probably be one of the shirts, but probably wouldn't sell. I was just as bad as every person that we serve. I'm not trying to make it sound like I was any worse off or better off. I don't like to share too much of the details because I prefer to talk about my recovery rather than my addiction. I find that too many people are telling what we call war stories at the meetings and kind of going on and on about how bad things are, and not enough people are talking about how good things could be or how good things are in sobriety. I love the opportunity to talk in front of anybody about that. So I'd like to back up to meetings and the advocacy part. Before, when I was going to 12-step groups, I was lucky enough to get into outpatient as well. Because not only was I just physically spent before I got sober, I was incredibly physically out of shape. I was mentally out of shape. I had attempted my own life while in the jail cell when I was arrested, which was the day before my sobriety date. Fun little fact, we fill out these cards at 12-step meetings, and we put our sobriety date. And originally I put October 5th. And then I went through and put a line through it a couple weeks later and put October 6th. And somebody caught that when they were going through the cards, that they were like, Chris, why'd you change your date? I said, I don't really want to remember that day. I like the other day. And they're like, fair enough, it's your coin. You get it whenever you want. Because that's the absolute truth. I don't like to refer to that day as a good day. The next day was by far the better day. When I was arrested, that was for my third DUI. My life literally flashed before my eyes. I thought about every mistake I made, every person I ever hurt, all the opportunities that I let slip by or waste. It was this really horrible individual moment that was just in front of all these other horrible moments that I had in my life leading up to that point, which led to almost having to go into a psychiatric unit while in jail waiting to get out. But I got out, and I had enough knowledge to know where to go, whether I wanted to or not. Meaning, I had been to 12-step meetings, and I never found them as helpful as other people do. I had questions. Some of the questions never got answered. I had grievances, and some of them just seemed to, people that I was talking to about the issues that I had seemed to fall on deaf ears. However, it being the only thing that I knew about at the time, I remembered something called the gift of desperation, and that's what ended me up back in 12-step meetings because, like I said, it was the only thing I knew to do. So from there, I learned what I could. I worked every step. I followed all the program guidelines. There's core components to AA, which I changed to the core components of recovery. And that's what I teach when I do certain presentations. And I teach people, no matter what pathway you choose, there's literature. There's people that have done it before you. So there's mentors, whether you want to call them mentors or sponsors or guides or whatever. There's a meditation or spiritual element to almost every program out there. There's volunteerism or service work, as the 12-steppers refer to it, in almost every program. So as my recovery pathway started to change when I discovered Smart Recovery, and I fell in love with it. Smart Recovery is a meeting that focuses on scientific studies, logic, reason. It is a departure from a spiritual program, but it is by far not anti-spiritual or anti-religious. It is just simply a different outlook or a different perspective on how to better yourself, how to deal with coping with urges and cravings to use, urges and cravings to drink or do other destructive behavior. And like I said, I fell in love with it. I eventually found myself working in Ann Arbor, which was my first job, working for an agency called Home of New Vision. And I quickly became a volunteer peer support coordinator, and then eventually this new thing that was called peer recovery coaching. I was part of the second group of people trained. The first people were the people that trained the second group of people. So I'm very happy to say that I'm still part of that initial group. A lot of those folks that were in my class, they're no longer around. Either they went on to other things, they got out of the field, they relapsed. Some of them just aren't on the planet anymore, unfortunately. But I was able to make a career out of it. That wasn't part of my initial plan at all. I really had no really no idea what I wanted to do with the rest of my life. I got sober at the age of 33. I drank myself out of grad school. I was a failed musician, sound engineer, and really had no idea what to do. So a lot of that stuff ended up coming back eventually as I was able to work it back into my life and not make it a positive instead of a negative. Make it something that I wanted to do versus something that I had to do. I learned about other pathways along the way besides Smart Recovery. And I started my own Smart Recovery meeting in Ann Arbor, and it went from 4 people to 40. And the only reason why I left it behind is because I ended up getting a much higher paying job, a better job in Wayne County working for Higera Health. So I couldn't be in 2 places at once. And I had to leave that meeting. There's still Smart meetings in Ann Arbor. I also learned eventually about Recovery Dharma, which is a meditation pathway. And that helped me get more well-rounded because I had the spiritual background with AA, the scientific background with Smart, and then Recovery Dharma kind of tied it all in. And over the years, I've learned that it's not just about meetings, it's about clinical services, and it's about getting with the individual and finding out what they like and what they used to like and what they're thinking about trying to do, or maybe they're afraid of trying, whether it's music, art, gardening, fitness, whatever. I get to work all these things in with people at work, and I get to, I sent Sue a presentation that I show, and it's like a 90-minute presentation, and I said, I know I only have 10 minutes, so I wasn't planning on going through that, but this is kind of what I'd like to talk about. It's the multiple pathways part of it. Not just because I think it'll help other people, it's because I know it helped me. So there's a lot of people that become disenfranchised with the 12-step community for whatever reason, and I'm not saying they should never go to those meetings again. I'm saying that there are other options. Sometimes when they find these other options, they realize that these meetings can work together. There's no rule saying you only have to swear allegiance to one pathway and that's it. I use a tools reference to everybody I talk to because I use the word tools, plural, more than one. And I don't know of any mechanic or any person that, handyman or anything like that, that just has one tool, right? They have a bag of tools, and they know how, at least have working knowledge of how to use each one for each situation. And meetings and resources and medications, they're all the same. And I could, that's just one aspect. Of course, there's medications and different forms of groups. I run into a lot of issues with people that are grieving from loss, and I wish I could just hand them over to a grief counselor right away, but that's just not the way things are set up. In the way the world is now, there's a lot of people that are struggling with mental illness, so it's really hard, especially working at a hospital sometimes, is who gets to talk to this person? Who gets to take the lead between its medical or psych or substance? So sometimes that can take time to figure out, and it can be gratifying, but also frustrating. So I'm going to leave it at leave it at this. Thank you guys for having me. Sorry, I just worked all day and I'm kind of tired. But thank you very much for having me and giving me the opportunity to share with you today.
Thank you. Thanks, Chris. Anybody on the board have any questions or observations or questions? Yes, Dr.
I do have one question. When you meet them in the hospital, is that just a one-time visit, or do you follow them back to the community?
I'm able to meet with them if they want to. I have the opportunity to either have them come back to the hospital and meet with them at the cafeteria or somewhere out around the grounds, the lobby, kind of try to keep it not as official. If they would like something more official, like an office, I have them meet me at Higera's Lincoln Park office, and I just borrow whatever empty office is there at the time.
Thank you.
Thank you.
Anyone else? Well, Chris, the story is very compelling. I mean, we could have heard a pin drop in here. There's a lot of people here. So what do you say to families who have a family member? What would you say to them? How do you get somebody to take that first step or to acknowledge they have a problem that needs to be addressed? What do you say to families? How would you approach them?
I get Facebook messaged a lot by individuals, and I get families that call, and it gets rerouted to me. So I talk to families often. Eventually, I ask, does this person want to talk to me? And if they don't, then that doesn't mean the conversation's over, but that's usually one of the first things I need to know. I offer the similar resources, like a multiple pathway approach to families as well. I try to walk them through it. They speak in generalities just to let them know if your loved one wishes to talk to me. I lay out, this is depending on what county or what insurance they have, this is the kind of the path that they can take. Since working at the hospital, I have much more knowledge on how to help individuals with private insurance, since I worked with the Medicaid population for many years and didn't have a whole lot of knowledge with private insurance. I try to show them a possible couple paths, and then I encourage them to provide the information. If it is an issue of setting boundaries, I tell them that sometimes, whether you want to or not, you have to set some strong boundaries, meaning you might have to remove yourself from the situation or have them removed. There is, the issue of just helping too much, right? And I hate the word enabling, but it just popped in my head. But it is an aspect of that where they just don't know what to do. So I offer them Smart Recovery Friends and Family. I offer them Al-Anon. There's an acronym called CRAFT, which is a community model. I try to get them to stay away from ultimatums unless they feel it's absolutely necessary. And then if they have to have ultimatums, then they have to be very specific. They can't just say, you do this or else, because that doesn't really work with that population, because it sounds threatening. Right. So if you continue to do this, this is the boundary that we're going to set.
Okay. Well, thank you very much. We wish you nothing but the absolute best, and we hope you get that #1 hit with your band.
Thank you. Thank you.
Thank you very much.
Thank you.
All right. Next on the agenda is my report, and I just want to share very quickly that we have a lot of issues that we're dealing with at a high level. We don't have a state budget yet, so we have that going on, which affects the county budget, which I believe is being voted on Thursday, and we're hoping for some good things out of that. And we don't know what federal funding is going to be. So, quite frankly, from a financial viewpoint, out of our hands, or monetary viewpoint, it's a little bit of a mess. But we can't get consumed by that, and we just have to keep going on our mission and what we're doing. And eventually, these things work themselves out. Not always the best, but they're going to work themselves out, because all these things need to be funded, and we're going to get there. But that's consumed a lot of time. I spent last night talking to a legislator about the importance of having a budget, and that we don't need an interruption in services, and we don't even really want to talk about that, but we have to think about it a little bit, because we are getting down to the finish line here of October 1st with the state budget. But that being said, and of course we also have the whole RFP situation going on. So we're gonna keep focused, right, Dana?
Yes.
You and the team are focused, and keep moving forward, and these things will sort out as they need to. So that's my report on that. And now we'll go to our board approval items. And the first thing we have is the MedPercent contract, which was reviewed and approved for board consideration by the Finance Committee last week. Can we have a motion?
I'll move for approval and note that we have the corrected number for the previous contract amount in the board packet.
Support?
Motion and support. Is there any discussion? Could we have a roll call vote, please?
Mr. Furman?
Yes.
Dr. Guadalupe? Yes. Dr. Hans?
Yes.
Ms. Woodruff? Ms. Newman?
Yes.
Mr. Young?
Yes.
Pastor Jones?
Yes.
Mr. Smith?
Yes.
Dr. Giles?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Next is the CMHSP contract, which was presented last week for consideration and approved by the Finance Committee for today's board meeting.
Move for approval.
A motion and support. Is there any discussion? Roll call vote, please.
Dr. Giles? Mr. Smith?
Yes.
Pastor Jones?
Yes.
Mr. Young?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Yes. Dr. Guadalupe?
Yes.
Mr. Furman?
Yes.
Motion carries.
Next is our PIHP contract. This is a small one. It's $460 million plus. It is the largest contract we have. Unfortunately, we didn't have the number last week. Dana, can I assume that the team has reviewed this and it's an accurate number we've received from the state?
Yes. Yes,
Okay.
it's accurate.
Okay.
And this
So-
is the Medicaid funds, so.
Right.
This
This
is the
is
biggest
this
of
is
the two.
this covers the Medicaid services, the
Yes.
whole wide range of services that we provide in mental health and substance abuse and others. So this really is the contract is a contract. It's really a number that needs to be plugged in because it's a number we get from the state. It's not our number that we generate. So the director has told us that the number is accurate for what the state is providing. So I would ask for, even though it hasn't run through the finance contract, we need to have this signed this month. So I would ask that that there be a motion for approval.
Move for approval.
Support?
Is there any discussion?
I just have a quick question.
Yes.
So through this RFP process, I've heard of some of the complaints of PIHPs not signing the contract and so forth. Does this mean we've signed the contract or will be?
Yes, we signed the original contract. That actually started last fiscal year, fiscal '25, and this is the contract for fiscal '26. So we had some discussions with the state last year when we were trying to negotiate some of the terms, but we did end up signing that contract. And so same thing is planned for this year.
Thank you.
If there's no further discussion, then we'll have a roll call vote, please.
Mr. Furman?
Yes.
Dr. Guadalupe? Yes. Dr. Hans?
Yes.
Ms. Woodruff? Yes. Ms. Newman?
Yes.
Mr. Young?
Yes.
Pastor Jones?
Yes.
Mr. Smith?
Yes.
Dr. Giles?
Yes.
Motion carries.
Thank you. Next, we have the Rosati contract, which is outside law firm that provides legal services and has for several years. This was reviewed and discussed last week by the Finance Committee and approved for consideration to the full board.
Move for approval.
Support?
A motion and support. Is there any discussion?
Dr. Giles?
Yes.
Yes.
Mr. Smith?
Yes.
Pastor Jones?
Yes.
Mr. Young?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff? Dr. Hans? Dr. Guadalupe?
Yes.
Mr. Furman?
Yes.
Mr. Cowan?
Yes.
Motion carries.
All right. Next is our fiscal year 2026 annual plan. For those who may be watching or who are here, we discussed this both at our study session last month, and we also discussed it at our meeting last week. So there's no presentation this evening, but the plan has been distributed. It has been reviewed by the board and discussed in those 2 sessions. I don't recall if there was any follow-up on the plan. I think there were some questions, but I don't think there was any specific follow-up. So I would ask the board for approval of this plan.
So moved. Support.
A motion and support. Is there any discussion? Yes.
Thank you for presenting the annual plan at the committee of the whole meeting. But I must say that in the past, we have received that plan sometime in July. This short period with initial presentation at the study session, there was not enough time to discuss the plan. We did discuss it at the committee of the whole, but there wasn't enough time to review it and give some suggestions or comment in any meaningful way. Having said that, I know there are other pressing issues that we are facing, so I understand that we were in a tight timeline for this. But what I noticed in the last year or so, there appears to be some lack of alignment between the different components of our organization. So we have run into some speed bumps in our work, and I will hope that when we implement this plan, we also work on proper alignment between the different sections of our organization for the smooth carrying out of what our goals are for this year. Thank you.
Okay. Is there any further discussion? A roll call vote, please.
Mr. Furman?
Yes.
Dr. Guadalupe? Yes. Dr. Hans?
Yes.
Ms. Woodruff?
Yes.
Ms. Newman?
Yes.
Pastor Jones?
Yes.
Mr. Smith? Yes. Dr. Giles?
Yes.
Mr. Young?
Yes.
And Mr. Cowan?
Yes.
Motion carries.
Thank you. And then also, again, reviewed at both our study session and at the COW meeting were the 3-year strategic plan. And again, that was opportunity was given to discuss that and ask questions. So we're not going to have a formal presentation on that this evening. But I think it is good for the organization to have a 3-year plan, to be looking forward and looking outward. We have some uncertainties in the future, but as long as we're about providing services to the communities we serve, then that's what we're going to focus on. So at this time, I'd ask for a motion on the 3-year strategic plan.
So moved.
Support.
Is there any discussion?
I just want,
I'm sorry.
just
Yes.
a comment,
Yes.
just since it's a board meeting and not COW. Just thank you to everyone that did this, because this is a lot of work for both the strategic plan and the annual plan that I know Trish and your team, the whole team here put together. So I just want to say thank you for putting that all together, the time, because this is, like Mr. Cowan said, very important as we move forward. Thank you.
Thank you. Anyone else? Roll call vote, please.
Mr. Furman?
Yes.
Dr. Guadalupe? Dr. Hans?
Yes.
Ms. Woodruff? Ms. Newman?
Yes.
Mr. Young?
Yes.
Pastor Jones?
Yes.
Mr. Smith? Yes. Dr. Giles?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Finally, also we have another document that has been discussed, and that is at a prior meeting is our presentation by Ken Melvin was our 2026 annual budget. The budget does show us being in the black for the next fiscal year, which is good news. We've had some challenges the last couple of years, using a lot of our fund balance and savings to fund providers and fund services. So it's good to see, and I know we have some changes through the state in revenues, but we're still able to come up with a good number and be in a good place and provide the services we're expected to provide. So, that being said, if we'd have consideration for approval of our annual budget.
So moved.
A motion?
Support?
Support, is there any discussion? Roll call
Dr.
vote.
Giles?
Yes.
Mr. Smith? Pastor Jones?
Yes.
Mr. Young?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff? Dr. Hans?
Yes.
Dr. Guadalupe?
Yes.
Mr. Furman?
Yes.
Mr. Cowan?
Okay. Well, on behalf of the board, I just want to thank everyone who participated in the formulation of the plan, the strategic plan, and the budget, which means just about everybody in the building. So we appreciate all your efforts. We know it takes time out from the day-to-day things you're doing to think strategically, to think forward, to put together a budget for the various departments and get the input, and we appreciate all those efforts. Next is our Outfront Media contract. Again, this was discussed at the COW meeting last week and approved by the Finance Committee for consideration this evening.
Move for approval. Support?
Motion and support. Is there any discussion? A roll call vote, please.
Mr. Furman?
Yes.
Dr. Guadalupe?
Yes.
Dr. Hans? Ms. Woodruff? Ms. Newman?
Yes.
Mr. Young?
Yes.
Pastor Jones?
Yes.
Mr. Smith?
Yes.
Dr. Giles?
Yes.
Mr. Cowan?
Yes. Thank you. And finally, as for board approval items, our last one, the anti-stigma contract. Again, this was,
You got Comcast.
pardon me?
You have 2 billboard contracts, H&I.
Oh, I'm sorry. I missed I put a check mark next to Comcast before we voted on it. That's all right. Okay, so we have the Comcast contract. Thank you for pointing that out. And that was again reviewed at the Finance Committee last week and approved for consideration this evening.
Move for approval. Support?
A motion and support. Is there any discussion? All those in favor? Oh, I'm sorry. Roll
Dr.
call vote,
Giles?
yeah.
Yes.
Mr. Smith?
Yes.
Pastor Jones?
Yes.
Mr. Young?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff? Dr. Hans?
Yes.
Dr. Guadalupe?
Yes.
Mr. Furman?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Okay. Our last contract this evening, it's been a busy night, is our anti-stigma contract. Again, this was also reviewed by the Finance Committee last week and is for consideration before the board this evening.
Move for approval. Support?
A motion and support? Yes. Yes. Thank you. You are so recused. Is there any discussion? If you want to have a roll call vote, please.
Sure. Dr. Giles?
Yes.
Mr. Smith?
Yes.
Pastor Jones?
Yes.
Mr. Young?
Yes.
Ms. Woodruff? Dr. Hans?
Yes.
Dr. Guadalupe?
Yes.
Mr. Furman?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Okay. We just had the grand slam tonight. We had the strategic plan for 3 years, the annual plan, the annual budget, and we also had our largest contract. So I guess we're done for the night. Let's go. No, we still got a few things to go. First, we have the consent agenda, which is board approvals for our last meeting minutes, recipient rights, committee of the whole, citizens advisory, and then receive and file our SUD strategic plan and financial update report from Mr. Melvin.
Move for approval. Support?
There's no discussion on consent items, and we'll just have a voice vote.
vote.
Yes, all those in favor say aye.
Aye.
All those opposed, the motion carries. Is there any other business to bring before the board this evening, either from staff or the board? Yes, Dr. Guadalupe.
I don't know if this is the right time, but I do just have a question, because I can't remember the timing last year. But last year we had, I think it was a contract vote for healthcare insurance for employees, and I remember we had some discussion. We were on a very tight time frame. I'm just asking, I think that probably is coming up in the next couple of months. If that does, can we have earlier lead time on that so that there can be discussion, please?
Perfect timing. Actually, next month, we're prepared to present the renewed benefits for our staff and our team. So you'll see that at the COW and then for final approval and review during the general board meeting. So we just met on Monday, so perfect timing.
Thank you.
And also as a reminder, Dana, that it goes from calendar year for benefits, so it would be in line for January 1st.
Yeah, I just remember we had to make a decision, we wanted more time, and I just want to make sure that we all have time to review that, please. Thank you.
And you're right, Dr. Guadalupe, we made big changes last year, and this year I'm happy to report it's much better outlook and no changes.
Thank you for bringing that up, and we look forward to getting that information. Anyone else?
Yeah, I will second Dr. Guadalupe's comments because I think the insurances are going to roll out their enrollment notices probably end of this month from what I have heard. So yeah, it's about time that we started reviewing the benefit packages. Thank you.
Okay. All right, next we have our board reports, the Recipient Rights Advisory Committee. Dr. Guadalupe?
Yes, so I'm reporting from our August meeting since those notes were approved at our last meeting on September 4th. During the August meeting, Trish and Francis provided an update on the PIHP RFP bid process and a legislative update. The group continued to review the Your Rights Handbook. There was a question and answer time about the PIHP RFP bid process from the members. There was a fiscal year 25 goal update. New phone numbers for customer service and Office of Recipients' Rights was provided. And then there always is a section for members to ask me to bring forth items. So there continues to be conversation about transportation issues, and then they wanted to make sure that as we advocate for PIHP RFP bid process, that we are making it, the terminology that's being used is easy to understand. So some people did not know or had questions on what is a PIHP and the whole kind of process with that. So just saying that the community doesn't necessarily always understand the important parts or how to advocate and to find a way to do that. And our next meeting will be on October 2nd. Thank you.
Thank you. We also have the Citizens Advisory Committee. Christina's not here. Did anybody have an update on that, or we'll hold that in abeyance then, and she can report on that at the next meeting. Now is the second opportunity for public comment. If there's anyone who wishes to address the board, when you come up, please mention your name and address or where you are from or organization, and then please limit your comments to 3 minutes. Is there anyone online?
If you are online and wish to speak for public comment, please raise your hand at this time.
There's no one online. Is there anyone in the audience who wishes to address the board this evening? There being no one, we'll close public comment, and next we have the director's report from Dana. Thank you.
Good evening again. I'll start with recognizing that September is Suicide Prevention and Recovery Month. So this is a time that we unite as a community to raise awareness and promote healing and reaffirm our commitment to mental well-being, and also remind people that services and supports are available and who to call when you are in need of assistance. So that 988 number is really important for us to tell our family and friends about how to contact and who to contact when you need assistance in that area. Also, we are coming up on our annual recovery celebration on this Friday, September 19th, and you're all invited. Here at our office, it's always a huge, huge deal. I think last year we had over, Megan, 500 people in attendance, and this year we're expecting the same. So a lot of it's an exciting day for all of us to have everyone in our parking lot filled and just inspiring one another about recovery and how possible it is when you work on that. And we had a great example this evening of our peer recovery coach. The other thing I wanted to talk about has to do with our focus on our priorities, and I know there's a lot of talk on the PHIP, which is a prepaid inpatient health plan, which is really our managed care contract for the Medicaid covered services we provide and oversee. And so that RFP came out on October 6th, and also, well, I'm sorry, I got my date wrong. I believe it was September. Where is the date? September 12th, I'm sorry. And so we were supposed, no, I had it right, August 4th, was it August 4th? It doesn't seem like that long. August 4th, and then we had questions that were due back to us a couple of times, and we finally received answers to the bidders' questions on this past Friday, which also pushed back the proposal due date to October 13th. So we are doing a lot of planning around that, and we're also continuing to work as if, you know, this will not have a huge impact on us, even though we do think there will be some major changes in how we do what we do. So there are two things that I always want to put in my report, and it goes back to what Dr. Guadalupe mentioned, is what is a prepaid inpatient health plan, or PIHP, and what is a CMHSP. And those are the things that, you know, are very confusing for a lot of people. And also the understanding of what does what. So our contract as a CMHSP is really the service provider network. And so as a CMHSP, we're able to provide direct services as well as manage the network of CMH clinics and providers. That includes our SUD providers, our ABA providers, the full array of our residential and vocational providers as well. The PIHP contract, or the prepaid inpatient contract, is our managed care contract. That allows us to contract with the state, get that $460 million, and pay for those services that are provided throughout our network. The other things I want to keep in mind or keep on the forefront goes back to the focus areas that we're working on. And one is really improving our managed care process. As we take in those delegated functions, for example, the FMS, the fiscal management services, contracts, and management of those contracts, we're finding opportunities to make improvements. So we're working really closely with our providers to make sure that things are occurring the way they're supposed to. We're happy and we're welcoming people from the community, people who receive services, our loved ones who are advocating on their behalf to tell us what's working and what's not working. And sometimes that draws our attention to other things, and we're looking at our data. We're working with our providers to make sure that everybody has a smooth transition. And as you know, we can't hide. There are some areas where we're hitting bumps in the road, and we want to make sure that these bumps don't become major problems for people who are trying to receive self-directed services. So that's an ongoing improvement process. The other thing I wanted to talk about has to do with self-determination and the fiscal management services, and how we're working directly with our providers of those services, where those functions were administered by them, but now we're working with them to bring some of that administrative work internally so that they can be free to really work with the community without the burden of those administrative tasks. The other part has to do with, we talked about our standardized rates and the fee for services, which really allows us to better analyze our data to see the cost of care and really work with our providers to make sure that people or providers who are providing the same services, same types of locations, are paid the same rates. So we found a lot of discrepancies when we started this, and now we're seeing where the standardization is really coming to play. And as Ken mentioned, our deputy CFO, as we get more data, we'll be able to give you better reports on how it's working, or even roadblocks that we may hit. Medicaid redeterminations, and I know Mr. Smith brought this up last week and how we've been looking at for over a year, but I'll tell you, we're still finding some concerns still this year as it relates to errors in determination, people losing their Medicaid, people on Medicaid spin downs, people who may lose their benefits as a result of Medicaid reductions. So we want to make sure that we're working closely with our DHS workers. They were called MARA workers, now they're called something else, and I can't tell you what they're called now. But we're working very closely with our workers to make sure that they're accessible by the people we serve, but also working with them when we're coming across concerns that we may see somebody may be in a situation where they're really a DAB, a disabled, age, or blind category, but they're in a TANF, a temporary aid and needy families, or in a Plan First, which is a family planning benefit with no behavioral health coverage. So as we see those things come across, or we're looking at individuals who are fully covered at one point and are now losing their coverage, or we're having to use general funds to help with their Medicaid spend down, or to cover some of their services altogether, we want to make sure that we're addressing that on a state level to make sure that they're getting the Medicaid that they're entitled to. Finally, with the Certified Community Behavioral Health, or the CCBHCs, as of October 1st, the state will pay the CCBHCs, and the two we have in our community are CNS Healthcare and Easter Seals Morgue. So the state, as of October 1st, will pay them directly. That's a prospective payment that they get when they provide those services. That amount of money, I believe, Ken, has already been taken out of our budget that we would have normally administered and paid the CCBHCs. So a lot of things going on. We're really looking at making our crisis services more comprehensive. So you'll probably hear from the community as we make those adjustments, and we'll give you more information, even present something formally to this board when we have worked out some of the kinks in our plan. And also, finally, again, right, looking at the direct services that we provide and making sure as we see our Medicaid dollars being reduced, that we're reimbursed for those services that we're providing directly. So those are things like our assessment center, the ABA assessments, the walk-in clinic that we're working with Honor, and there is an opening, a grand opening or a reopening celebration that's coming up soon, and maybe Suzanne has that information she'll share with us. Also, our co-responders is another service that we provide directly, veterans and school mental health navigators, and integrated care nurse managers. So those are just a few of the services that we're providing directly to this community. We want to make sure that we're able to receive those Medicaid reimbursements for those services. So with that, I will stop. There's a lot of information on the RFP, so if you have questions, please let me know. I have a packet of responses from the state right here that we're all going through, preparing to respond to the RFP.
My question related to the CCBHC, was there an administrative fee that we received for the pass-through?
There was a 1% that we received for the pass-through and administrative work that we do.
So what type of loss is that for the agency?
Ken, do you have that number off the top of your head? The amount that was reduced? Was it?
I don't have that number, but it's relatively small compared to the reduction of our base cap. That's the real impact, but that's reflected as well. So, candidly, I don't know what the administrative fee actually covers the administrative expense.
Right.
Thank you.
What time is the celebration on Friday?
11 o'clock. Starts at 11. It's right here in our parking lot.
Yes, Chris. What is the expectation and timing involvement of the board in the RFP submission?
Honestly, anything that we're going to present that would require your input, we would bring to you in a meeting or even on a board study session. With this timeline being so close, if there was something that we require to do that requires the board approval or even for us to go to the Board of Commissioners, we'll let you know very, very soon. And that may be something that I would have to reach out to our chair even to ask for a special meeting to be held because, again, the timeline has changed. There have been 5 amendments to this RFP since it was distributed, and it's probably, I couldn't remember the exact date, but so 5 amendments. We're on our 5th amendment, and there are, I think, over 300 questions and answers, some answers.
Yeah,
that.
I totally understand that and totally do not have unrealistic expectations. It's just sitting here as a board member, you also think about something, it's hard to think of something more existential to the organization than this RFP. So it's a balance and you have my commitment to be available, but I do think it should require a board vote.
You know, and I appreciate that. And the problem with it in just being very transparent, because there were so many questions and so much going on with the changes, we really didn't know how to even begin to present what was in this RFP. Now we have some sense, and we've been working on advocacy efforts even to stop the RFP. And the other things that I did not mention, and I should have, I'm glad you brought it up, is that on Wednesday is Walk a Mile. Well, tomorrow is Walk a Mile in Our Shoes, and that is in Lansing. It starts at 11. One of the significant things about this year's Walk a Mile in Our Shoes in Lansing is the advocacy piece is going to be met with having retired Senator Debbie Stabenow speak in support of the PIHPs and against the RFP. So that's going to be huge in terms of advocating and seeing how far we really can get in terms of any change or any delay of this whole thing. The other thing I'll tell you is that there are a couple of lawsuits out there right now that are pending, and that is another strategy by Community Mental Health Association to eliminate the RP or have it thrown out somehow. So there's so many moving parts that as much as we can let you guys know about, we will share that information. The other thing is on Saturday, there is the NAMI walk, and that is a walk that occurs in Detroit. I believe it's on the University of Detroit Mercy this year, and that's a huge advocacy event as well. And I'm sure there'll be some discussion and some announcements about this RFP.
And Chris, to address your question, I mean, unfortunately, we are in totally uncharted territory. This is off the charts. I feel confident that Dana and the team are going to do a good job. However, what is the date you have to, what is the response date now?
The 13th, October 13th.
Okay.
Yeah, it was originally the 6th in the original.
That's our COW meeting, yeah.
Yeah.
So, okay, well.
Yeah. So our plan, honestly, is to have it done at least a week before it's due, so that we can go through it, have people look at it, get some feedback on what we're presenting. And I heard from Frances, who's our guru in doing these type of things, is that this RFP is pretty standard compared to other things she's applied for, and in comparison to a CCBHC certification application, she said it's much easier. I think what makes it complicated is some of the newer things that they have required, such as maybe another board, a regional board that would consist of this new region, and who would appoint that board. A lot of those things are still not clear, and so I'm hoping to find additional answers in this FAQ that we have. Do we have to create a whole separate entity? That's another thing. Do we have to partner, or can we do this as a standalone? There are several different components that we are looking at, and we also wanted to know if we presented more than one proposal, would it sort of dismiss us all together? So if you put in multiple different models or ways or ideas, is it going to, throw us out of the bidding at all?
Okay. Right. Maybe at the study session, maybe they give a little update if we know where we're headed. Okay. We'll figure this out. We got 3 weeks to do it. Okay. All right. No other questions?
Mr. Cohen, there was a hand raised that we didn't catch for public comment. She's got her hand up right now, just so you know.
Okay. If we're going to go to public comment, I unfortunately have to leave. I have a family health issue I got to take care of this evening, so I'm going to hand the gavel over to Tim Alkaya to take us home. So I want to thank the board and everyone for their efforts this evening. We got a lot accomplished, and I apologize that I have to go. Thank you.
Thank you, Dennis.
Yeah.
Did you have your hand up? Yes.
So,
Am I
the
allowed to?
next, my question is about this
Oh.
RFP. Will that be the subject on the study session this month?
What I just heard from our chair is that there will be an update we can provide for sure.
Next on our agenda is board member comments. We could start with.
Miss Newman, we have a public comment that we didn't catch.
Right.
Oh, okay.
Sorry.
Can I speak now?
Yep, Jennifer, you can go ahead. You have 3 minutes. If you can just state your name. Thank you.
Yeah, my name is Jennifer Troy. I have been working in this field for over 20 years. I have my own business. It's very small. And what I'm hearing has nothing to do with the care of the individuals who are disabled, who we need to take care of. I'm hearing, oh, we're going to have good benefits next year. But what we're getting back is we're going to get cut. I want to understand, and I will admit, this is my first meeting I've listened to, so I have some educating for myself to do. But I want to understand how you can have a meeting and celebrate everything you're doing when I don't even know what the rates are going to be October 1st for the disabled people that require 24/7 care.
Were you finished with your comments?
Apparently.
We have someone else that wants to make a comment? No? Okay, thank you. So next is time for board member comments. We start with Adam.
There we go. I'd like to echo what people have said tonight in terms of the approval items and just the amount of work that went into preparing each of those documents and reviewing those. And I'd also like to thank Chris for his presentation tonight, giving us a window into what recovery coaching is and just letting us know what a vital role that is and how it helps so many people that we serve within our network. Have a good night.
Thank you, Dr. Guadalupe.
Just again, thank you to those who put together, we had a lot tonight, our budget, the strategic plan, annual plan, a lot of good information there, and to the team that, everyone who is working with this PIHP bid. We know it's a lot of work and very short time to turn over that information, so thanks for all the time and effort being put into that. Thank you.
Dr. Hines?
No comment.
Yvette?
I echo the sentiments of the prior board members in terms of the hard work that's being done by the staff that's present. Thank you.
Thank you.
I get to go before you this time. All right, I have tactical stuff. I'm looking at the calendar and it says cow is on the 6th, which is different than it normally is. So for clarification, are we the 6th or the 13th? That's what I'm wondering, so I'm asking.
I have the 6th down. I think everything got moved because the conference is that last week in October.
Did you have any other comments?
Well, and then on the CCHB, as I recall from the Finance Committee, the difference between revenue change and expense elimination was pretty substantial. Is that correct? Correct. Okay, just to clarify.
So you are correct, the board COW meeting is scheduled for October 6th. The board meeting's a week earlier for October 14th. The study session is October 23rd, probably, and the CMHA conference is at the end of the month in October.
Okay, which
On the 26th.
changes the whole complexion of the COW meeting, which is why I'm going to dwell on it. So we are going to have an update. I mean, this just like we had to approve the 400 million, we are going to have an update, so, thank you.
So we'll add that to the study session agenda, which is next week, so we can
I think we need
adjust
both.
the agenda for
Right.
at the executive meeting.
I think we need both, and Ken,
Mm-hmm.
I mean, we're going to have to get into, I mean, everything's changing, right? That's why it's confusing to everybody, especially those that have to live with it literally every day. So I think in terms of the impact of the budget as we start in, and then the PHP potential contract, so, thanks.
Pastor Jones, did you have any comments?
Only to, first of all, thank you, and thanks for everybody's comments tonight. But just wanted to put a shout out for Christopher. What a great presentation. 17 years sober. 17 years. That's an achievement. And he certainly, his report gave us an opportunity to say that you can make it if you try. So a big shout out to him for the report, and thanks to everybody on the board.
Chris, did you have any comments?
Yeah, just real quick, I just want to, it's mind-boggling the number of parts that are moving right now between the RFP, federal budget, state budget, blah, blah, blah. And I do commend the organization and hope that we keep our chin up and remember we're Oakland County and we can do this and we can lead the way. In the middle of this, I've been reading the new Medicaid provider manual updates for the Wasco settlement, and I know that's right in the middle of all of this, but I hope the organization embraces it as much as we can. We were talking earlier before the meeting, like, you know, I hope our attitude on this, because I think it addresses a lot of the concerns we heard at last meeting, if we can adopt some of the principles that are going into the Medicaid provider manual as far as Wasco. And, you know, to the extent, you know, we are running into problems, I hope the answer, as I've said before, is no but, so we can come up with solutions and partnerships before it. And I hope the implementation of the Wasco settlement is something we can get some updates on in the future. So, thank you.
Dr. Giles?
No comment.
No
Thank
comments? Okay, if there's no other business, the meeting is adjourned. Oh.